Shalom. Shalom, shalom, family. I would like to welcome you to another live discussion of Black and Healthy Restoring Black America. Today, we are going to take a look into a long history of disparities in the Black community and other minority community that have suffered from centuries of racial bias, stereotypes, and just fear that has had devastating effects on our health and our nutrition. This channel is dedicated to the educating and providing resources and material for the Black community who lack essential resources for proper health and nutrition. This channel will also work collaboratively. Oh my goodness, collaboratively with healthcare professionals to bring valuable information and discussions that may lead to legislative change in our community and improve the health and well-being of those affected by uh, systemic discrimination and racism. I thank you all for joining me today. I am new to YouTube streaming and everything, so I ask you to bear with me if I'm stumbling over things. I'm struggle streaming all the time. so, um, but I do thank you for joining me today. So, first, I would like to open up the discussion with some research that I have collected concerning this topic. There's much research out there. There's many people in the communities that are trying to improve the health of minorities and helping with the disparaging biases and stereotypes that often plague people of color. In the first thing I would like to share with you guys is a research article that I found, a research journal that I found. Here we go again with my struggle streaming. Um, that discusses what discrimination in America looks like. It also gives an overall history of the what has been in legislature to also talk that keeps people from access to care, to also the biases that keeps treatment away from people. This particular, let me see if I can enlarge that because it looks okay. Yeah, this particular article was talking about a historical overview of racial discrimination in healthcare, pre Civil War to present day. This was a research journal done by, let's see, the Boston College. And it was talking about African Americans specifically on the history of how we were used for experimentation. There were racial biases and myths that were passed on generation to generation that pretty much told why we could endure all this mistreatment. Um, uh, in the first paragraph I highlighted, it says African Americans have been victims of discrimination in the healthcare sector of American society prior to the Civil War and abolition of slavery in the United States. Some of these things, in addition, during the pre Civil War period, African Americans were, I like to use Black Americans because everyone doesn't attest to being African American, but I will say Black Americans were used in various non consensual medical experiments. European American doctors often used living African Americans in a wide variety of experimental contexts. During the 1800s, European and American physicians used blacks, Black Americans to develop gynecological surgical techniques and to determine either whether ether was an effective general anesthesia. Thomas Jefferson also inoculated 200 of his slaves with the smallpox virus in order to determine the viability of his experimental vaccine. I know that sounds familiar to some people. And also, let's see, others, let's see, also there were boiling water on the spinal columns to discover whether this was an effective treatment for typhoid pneumonia. Oh my goodness, that just sounds horrible. Um, Following the conclusion of the Civil War and the emancipation, African Americans continued to confront overt racism in the healthcare system during Reconstruction, and both the North and the South discriminated against Americans. And we do know there were laws put in place during the Jim Crow era that also prevented us from going to medical schools. One example of that that was brought up, actually, um, that was brought up was there was a movie that Most Def actually was in, and it was, let's see, called something the Lord made. It was a movie documenting the life of Vivian Thomas, who was a laboratory technician in the John Hopkins Institute, and he'd worked with a Dr. Blaylock, who was the first physician to operate on the heart of children. They were called the Blue Babies, and Vivian Thomas was instrumental in creating the stitch that allowed the heart to grow and the stitch not break apart and causing the child to die. He created that stitch by working with Dr. Blaylock, but never got any recognition for those things until he was almost near death. And there were many things in the healthcare system and in written in law in that time that kept very educated Black people from even going to medical school. I want to share a clip that's here on YouTube of this movie if you haven't seen it. And if you would, you can always find it on YouTube. So I have the link to it in the description. So let's see. I'm going to share that with you.
Morning. Why would a doctor want to hire a cop? So where my work is done, what is the work medical research? Mm-hmm. Let me see those hands.
Oh my God. Oh, Vivian! He's working at a hospital, right? Yeah. Everyone busy outside.
Vivian, Dr. Blaylock wanted you to have this.
Excuse me, all workers punch in at the rear entrance.
He's with me.
I'm sorry, Dr. Blaylock, but that's the rules.
I don't think that she's breathing right now. I don't think that she's breathing.
The baby back there. Come on.
6 months. Are you going to take this on, Doctor?
No one's ever done anything as hard as this.
You can't operate on the heart. That's basic.
There must be a way to get
Oops. Sorry about that.
more blood to the lungs.
We focus on the pulmonary artery.
Who on this God's earth are you?
Got that white coat. You just the class.
This movie was very good, you guys.
What about you going to medical school?
You don't have to remind me of that, Clara. We have a family now.
Let's start with experiments. Let's break their rules. You can begin the incision.
I'm not ready for that.
If I say you're ready, you're ready.
You have to see this. Vivian Thomas is operating, assisted by the chief of surgery.
Retract.
No sushi.
Can we try things my way occasionally? I think we found a way to repair your daughter's heart.
Your quest for glory is vain.
Postpone the operation until you have more experience.
Postponing means signing that baby's death warrant. I'm operating tomorrow. Agent Vivian Thomas.
What's wrong? What's happening?
Agent Vivian Thomas. You want to get OR right now. You're choking me through this scrubber.
What's he doing? You can resume your duties.
These are his duties. We made history together. You changed the world.
So just to see that, I mean, that movie, I do recommend that you go see. Like I said, it is available here on YouTube. Oh, let me stop the video. Oh my goodness. Thank you. Okay, struggle streaming, sorry. So getting back to my talking points was there were, even after the Civil War, after during Reconstruction, even when there were blacks moving up toward the north, it was always, there were still difficulties in our community, even with us trying to take care of ourselves. We had to try to create our own medical schools. We had to try to create our own nursing schools as well, because there Plessy versus Ferguson kept us from being educated with our counterparts, Caucasian Europeans. We weren't allowed to go to their schools. And so, and our schools were so extremely expensive, many of us couldn't even afford to go. So those were, not only in our career opportunities were limited, but of course, I mentioned the things in the article about the experimentation during the Civil War and pre-Civil War and post-Civil War, they continued to do. So, and then there's been much research that has actually done, but we're trying to find, not to just beat a dead horse to keep going over slavery happened. We know that. We know that those are the things that happened. But at this time, we're into 2021. We should not still be experiencing all these things. There should be more opportunity for us in healthcare, and that we have more access to it. Also, things have been trying. The Affordable Care Act was put in place to try to help. And I have some statistics on that that I'm going to share with you. Just a second. Working on it. Okay, I can take that down. And now, what I wanted to share with you now is an article, well, a coalition that actually is helping the communities the communities create equal opportunities and report those things and able to bring up, healthcare reform to the masses. So we are looking at the Century Foundation. This is the Century Foundation, and have they have an organization where you can report. They have events. They give resources and so on and so forth to help Americans, African Americans, as well as other marginalized groups. It's ran by Jamila Taylor. She's the director of health care reform and the senior fellow. She writes, the American healthcare system in beset with inequalities that have disproportionate impact on people of color and other marginalized groups. These inequalities contribute to the gaps in healthcare insurance coverage, even access to services, and poor health outcomes among certain populations. African Americans, Black Americans bear the brunt of these healthcare challenges. She writes statistics. Black Americans comprise 13% of the US population. Over the span of several decades, namely since the Civil Rights Act of 1964 and 1968, they have been able to make notable strides in the American society, but it the 40% women, just over 40% of African Americans own the home, and that rate has not changed since 1968. Also, she notes here things we should know. Of the more than 20 million people who have gained coverage under the ACA, 2.8 million of them are Black Americans. So, yeah, we make up a large percentage of what the need is in healthcare. It says the average American family spends around 11% of the household income on healthcare premiums and out of pocket costs. But that amount approaches 20% of Black American households. Because African American tend to be poorer than other demographic groups on average, public health insurance programs such as Medicaid are vital to ensure affordable health care and healthcare outcomes. Yet 14% of the states resisted the Medicaid expansion, and that was mostly in the South. And that is where our healthcare looks like in the South, where our poorest people and our people that need the most help, they're not getting it down there. I see Alyssa has joined me in the back. I'm going to bring her up. Oh, okay. Alyssa, oops. I guess I lost her. She came off. Okay. Let's see. Just a moment, beloved. Okay, I'm going to try to bring her back up.
I'm
Okay.
here.
Hi, Alyssa. How are you doing?
Hi, Jawanda. How are you? I'm well. How are you?
I'm doing well, and I'm glad you joined the stream today. So, what do you think about the talking points today that I've been bringing up about the healthcare disparities in our community? What I would like you to share your opinion of it. You have to unmute yourself. It's okay.
Sorry about
That's
that.
that's okay. Go ahead.
Uh, oh, I am so sorry. I am so sorry. If you could give me a minute, Dolly.
Oh, that's okay. Okay.
Jawanda, if you could give me a moment.
Yes, I will. Would you like me to take you
Can you
down?
hear me?
Yes, I can hear you. I can hear you. Okay. Well, we all struggle streaming, but
Okay. Can you give me a moment? I'm
yes,
sorry.
that's okay. I will give you a moment.
My phone keeps going in and out.
Oh,
I'm
okay.
sorry.
Oh, don't apologize. We all have problems with this. I've been struggle streaming since I started. But I am trying to improve myself with this. So I'm going to give Alyssa a few minutes and I will continue with what I was talking about. But um, in, um, in the article that Jamila Taylor presents to us, she also brings up even with improved access to medical care under the ACA, the disparities in healthcare outcomes between blacks and whites are still stark. Black women are 3 times more likely to die during pregnancy related causes than white women. For example, the black infant mortality rate is twice the rate of white infants. Certain social deterrents, health, such as poverty and income inequality, wealth inequality, food insecurity, lack of safe, affordable housing, um, have very important implications on health risk. So you find that people who are more more economically challenged to have poor health care and more and less opportunities to get uh, adequate health care. Those poor blacks that live in the rural areas in the rural South, um, they don't even have local hospitals. So, and they have to travel over 50 to 100 miles to get to the closest hospital that will give them public assistance. There may be other hospitals that may be privatized that they can't even go to because they don't have any health insurance. And that's a sad thing because the southern states, the southern states where most of our black are, they, I think it's I think it's insulting that they have not allowed the managed care programs and the extension programs into their states. It would help so many people because I myself am privy to the managed care program here in Ohio, and has done many good things for many of our people. So I'm just trying to see if Alyssa is ready yet. She will let me know when she's ready. But I also wanted to share another article I'm trying to find here. Okay, there we go. Let's see. Hopefully, my friend will be able to come on with her phone. She's working on her technical difficulties. I understand the technical difficulties. I think I need to drink some water because my teeth are sticking to my lips. So, mm, oh, pardon me. Thank you. But as I continue, The Century Foundation, which I have them posted in the link to in the description to so you can contact them and look at that page because they have a lot of helpful information about the managed care programs, the Affordable Care Act, the things that give us access to care like transportation. There's many states that don't have it. Alabama, there's so many states that did not adopt the program, and many people don't even know about the program. But it has really helped many obtain the things that they need at home. I think the saddest thing, I've worked in the community as a nurse of, let's see, I've been a nurse almost 24 years. Um, in the last 10, I've worked in case management in the community. And I've seen the saddest things, this, especially with our people. I've been to homes with no water, no heat, no lights. And there's a disabled person in a wheelchair with no help. And he's there by them. And this person, he or she, is there by themselves. So and it's disheartening because we as healthcare professionals see it every day, and it's a lot of times that we can't cross the boundaries of helping, but we send the resources. But if this person can't even get out of their home because they're in a wheelchair, but there are programs that could actually get them a stair lift to help them stay in their homes, or programs to help them get their gas and electric back on, and just to look into the social issues, because it's not just in our community, in many of the minority communities, it's not just our health, it's not just our economics, it's a plethora of things. Racial discrimination and systemic racism is real. If it wasn't real, we wouldn't be having discussions about it, and there wouldn't be all these articles about it and movies and everything else they talk about. But getting back on track about what I was saying, I have another article that I wanted to show you, and this is from the NCBI, the Bureau. Oh goodness, why am I messing up? Oh my goodness. It's Here's an article from the NCBI about racial disparities in healthcare, and it highlights from focus groups. Um, Let me see if I can bring it up. Share screen. Okay, I'm trying to find it. There we go, and share. Okay, let me see, make sure I got. Okay, I wanted to bring this up just to highlight some things for you. This is a research article that's in the NCBI. I have that listed in the 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 description link as well, so you can look through it. I'll just highlight some things. Um, this study basically covered. This study covered the context of income, education level, and social demographic factors of 8 focus group participants. They were asked to talk about their own personal experiences with racism in healthcare when asked whether discrimination exists in receiving quality healthcare. One Black American participant summed up the collective response in this way: the medical world just reflects the real world. Throughout the following sections, participants were attributed directly or indirectly to racial or ethnic discrimination with their lack of English proficiency or both. Some of the things she covered was effects of stereotyping. This was, let's see, she has quotes from different participants. Let's see. We look My son, okay, I'll read this one. My son broke my glasses, so I needed to get a prescription so I could buy a pair of glasses. I get there, and the optometrist was talking to me as if I was a 10-year-old child. As we were talking, they were saying, "What do you do?" And as soon as they found out what I did professionally, the whole attitude of this person changed towards me. I don't know if what they were, I don't know if they come in there thinking, oh, this poor Indian does not have a clue. I definitely felt like I was being treated differently. That was from a Native American participant. Um, there is a Hispanic participant. He says, my name is Jose. Let's just say Jose. And when they see that name, I think there is some kind of prejudice of that name. We're talking about on the phone, there's a lack of respect, there's a lack of acknowledging the person and making one feel welcome. All of the courtesies that go with the profession that they are paid to do are kind of put aside. They think they can get away with a lot, but here's another dumb Mexican. That was from one of the Hispanic participant. And then further down, they talk about the language barriers. Also, there was another one I seen when I was going through. Um, those are Hispanic. African. Let's see. Here's some Black American participants. I know that there has been a couple of times the doctor wanted to prescribe a certain medication, but because of how much it was, he prescribed something else, not what was best, but what I could afford. Oftentimes, the system gets away with the concept of black people off the 6 o'clock news, and they treat us all the same. Here's a guy coming in here with no insurance. He's low breed. A lot of black people don't have money, so I guess you would say it's hard to get quality health care. A lot of black people don't have any insurance. These are some of the the things that were written in the articles by the participants, just to let you know that I'm in, and I did show other minorities. They feel the same way. They feel less than as patients when they're going to the pharmacy. I myself have even as a healthcare professional, when I became a nurse initially, and I worked in a predominantly white facility, um, the patient would be, if the patient was Caucasian, they were absolutely flabbergasted when I would walk in their room with their medications, and they would think I wasn't the nurse. They would actually ask me to go get the nurse, and I would just sit there and I'm like, I'm the nurse. And I have had to actually ask a Caucasian nurse to pass medications for me for certain patients because I can't convince this older lady with, and she may have dementia too, that this black nurse in front of her is actually the one that is giving her the medicines. But I'm always the aide. So so or I'm the housekeeper. I've actually been somebody actually thought I was the access driver. I actually worked as an access driver, which is a transport uh, transportation person. They're the persons that actually just transport the people, and that's fine, and that's good if that's you have that job. I'm not putting those jobs down because I went up the ladder, and I will be doing a discussion on that to give some encouragement to those who may be single moms, because that was my situation at one time. And I had to work myself up the ladder to get to the degree that I needed and I wanted. I'm going to check to see if Alyssa is able. I think I lost her again. Oh, I think she's having problems with her connection. But I wanted to also, if anyone else wanted to join, or share your experiences in the healthcare system, anything that has happened that you felt like you were being discriminated against, or some issues of, people just having biased. I don't believe everybody just is mean or nasty. Purposely. I just believe people have stereotypes that they've heard over and over and over and again, and those things sit in the back of your mind. And as healthcare professionals, it's really dangerous when you go in and make assumptions. One of the things that we can talk about is the mistrust. Many of us Black Americans and other nations that are minority or are in this country, we don't trust the healthcare system. It's hard to trust the healthcare system because, pardon me, we feel like we're the guinea pigs. We're always the one that have to try out the new medications, or just like I showed you in the history, they would experiment on us just to see what the outcome would be if they didn't give us treatment. They already knew things like, well, we all know about the Tuskegee and experiments, the 40 years of syphilis and those poor people that it happened to. But I wanted to share another article with you guys again, um, just to bring up another article I have on. Oops, I meant to take that back down. Here we go, struggle streaming again. Uh, yeah, I'll get it straight one day. But here we go. There. I need to take that down to. Whoops. Here it is. Oh, I'm getting blind as a bat. Okay, here we go. Let's see. So we have the understanding and ameliorating of the medical mistrust among Black Americans. Well, let's talk about that. This article brings up in this issue, we focus on the topic of mistrust of trust of health care providers or systems among Black Americans who are much more likely than whites to get seriously ill and die from COVID, but less willing to take the coronavirus vaccine. To draw lessons on ways of building trust with the Black patients, we looked at clinical encounters in which the stakes of not addressing mistrust are high, including childbirth, childhood, vaccination, um, and the care of patients with HIV, cancer, and substance use disorder. Many of the programs we found have focused on improving communication, increasing transparency, and creating welcoming environments and intending to the access barriers among others approaches for engaging patients who have been poorly served by the healthcare system. Now, with all that being said, they also brought up The Tuskegee syphilis study, they also brought up the New York City Health Department's Bureau of HIV, and it says the mistrust of health care system persists even among Black medical professionals, such as Ani Blackstock, uh, MD, a physician, a primary care physician, researcher, and former assistant commissioner of the New York City Health Department's Bureau of HIV. When Blackstock's 7-year-old son needed to go to the emergency department for a skin abscess, she hesitated. The last time Blastock had taken him to the ED for a broken wrist, a white orthopedist reset the bone without giving him a painkiller. I I have never seen so. She says in quotes, "I have never seen so much fear in my child's face." Blackstock recalls, and I felt completely responsible. To avoid a similar experience, she phoned her twin sister and who is an ED physician, who called ahead to ensure that a trusted colleague would treat her nephew. Studies have found Black Americans are consistently undertreated for pain relative to white patients. One revealed half of the medical students and residents held one or more false beliefs about supposed biological differences between blacks and white patients. Like the former, like the former have higher pain tolerance than the latter. In addition to the kind of differential treatment, the healthcare system often gives short shrift to the physical and emotional tolls of exposure to the police brutality, substandard housing and schools, polluted neighborhoods, and other parts of daily experiences that some Black Americans have to face. When you're vulnerable to, when you're sick, you're vulnerable to many things. And those things, it's sad that those are many things that are taken advantage of by people with prejudice. And some people don't even have an explanation for why they do the things they do. You know, we don't we try to, as a healthcare professional, I have to treat everyone the same. Because I'm a Black healthcare professional, I sometimes are micromanage sometimes more than others that I feel. And even with that, I try to give all my clients the same type of care of from me. I don't have the racial biases. I can't. I'm not supposed to. And as a healthcare professional, you're not supposed to. But um, there is an explanation for it, but a lot of people don't like to talk about that elephant in the room. But I am happy to share with you and information that's coming from one of our renowned Black doctors of this country. I would like to share what uh, CNBC had a um, it's a short 9-minute video about changing Black doctors prescription for changing racial inequality in healthcare. And this is coming from the American Medical Association. And I would like to share that video with you, um, and the article that's attached to it. So I'm going to show you. This is Dr. Oliver Brooks, National Medical Association president. And this video highlights pandemic highlights inequalities in U.S. healthcare. So we're going to look at this video together and then we can talk about it. If I can get it to play. Oh, it probably has an ad coming up, which it probably does. So, okay, it was playing earlier. Of course, I'm struggle streaming. Oh, there's the wonderful ad. And it's buffering.
The pandemic has highlighted a disparity in healthcare in the United States. We're talking more and more about it now with two doctors on the front lines of the pandemic and the inequality of American healthcare.
Okay. Shalom, Melissa. I'm trying to see.
Hello, I'm back.
Okay. Just a moment. I'm trying to see why. I'm trying to share a video at this time with people, and it's just not. I had it buffered earlier, and now it wants to act up. But what I wanted to show is that I may have to take that down and do it again. But I'm glad you joined me, Alyssa. I'm glad that you were able to come on.
Thank you.
Oh, you're welcome. Alyssa is a longtime friend of mine and colleague. I actually worked with her as an STNA many years ago. We both went to college. She went into other things other than nursing. I'm pretty sure she was like, oh no, after that. But I was passionate about becoming a nurse, so I kept going. And we're still friends, even though we don't work together anymore. But I'm so happy that she's joined me because she does have some insight into the healthcare, system. So, Alyssa, would you like to share your opinion of this topic today? Yeah,
Sure.
Okay, thank you. Go ahead.
There's been many disparities in the Black community. I mean, I've observed a lot of disparities. Um, having worked in the medical field for a long time, I mean, I've seen it all the time where Black people, if they don't have adequate health care, due to their being lower income base, due to that, they suffer the inequalities of healthcare.
Do you have any personal experiences that you would like to share? You're muted.
I think that Black people, due to them being Black anyway, I think that um, a lot of the medical professionals uh, don't give Black people adequate care that they deserve due to them being Black.
Mm-hmm.
For example, Black people have the highest cases of diabetes and high blood pressure due to the inequalities.
Mm-hmm.
I mean, it's like inequalities all across the board. The justice system.
Absolutely.
Oh my goodness.
I mean,
we could go all day long with this one.
Yeah, and that's the thing. And what I'm trying to bring up, I don't know why that video didn't want to play, but it gives us a little hope. That's why I'm trying to bring it back up. But it's we've had a lot of Black doctors that have been in very high positions in the our healthcare system. and they're fighting now. I mean, George Floyd during the middle of a pandemic, it's just the combination of the two. Even though there's been many disparities over the hundreds and hundreds of years, it's just that those things, that was the first time I ever seen a coming together where there was actually a discussion brought to the table to finally say, okay, we know all the research on all this inequality stuff. So what do we do to help stop it or help those who are doing it, um, to help come up with a solution? Because we all have to live. We're not gonna disappear. We're all here. There's people from nations of other people, and America is a big melting pot of different people. And we're all pretty much immigrants here, except the Native Americans. And the thing is that we spend most of our time arguing and fighting for things that we just need to find a solution for it. As a case manager, that's what I do. I find solutions for things that people need. They need DME in their house. I can find resources for it. And it's sad to see that all the states didn't even adopt the Affordable Care Act. That's sad. That's sad because I seen what it did in Ohio. So I know that it's done things across the nation, that those states that did adopt the managed care programs. But you got some uppity people down south that still don't want to do that. So I have so much, I have so much problems, so many problems trying to wrap my head around why don't we collaborate to get a solution to these things. And I'm hoping this plays now. I tried to bring it back up again. Hold on, I'm just trying to bring up Miss, because this article is about it's an article and a video that was by CNBC, which I don't watch that often, but when they have something good on there, I will pay attention to it. But this is Dr. Oliver Brooks, who is the National Medical Association president. I shared him once before, but I'm going to try to play this video for you, and so you guys can see what
The pandemic has
he's coming up with. Oh, please play. They don't want to play. Oh, it's loading the ad. Don't you just love your ads? Oh, goodness.
Unjunk your sleep at
Okay.
Mattress Firm Semi-Annual.
Let's stop sharing until it gets through the ad. Oh, my goodness. So while that ad is playing, and I'm trying to get to the video, hopefully it doesn't stop. Okay, there we go. Let's try it now. Oh. Okay. Why is struggle streaming again? Pardon me, honey. Okay, let's bring it back up again. Share.
Plus, get a free adjustable base with qualifying Sealy purchase up to a $4.99 value. Unjunk
I
your sleep
can't skip
only at Mattress
that.
Firm.
Sorry, guys.
highlighted a disparity in healthcare in the United States. We're talking more and more about it now with two doctors on the front lines of the pandemic and the inequality of American healthcare. Bertha Coombs is here to lead the conversation. Bertha.
Thanks very much, Tyler. You know, some African-American doctors writing in the New England Journal of Medicine this week framed the twin crises of the COVID pandemic and the social unrest in the wake of George Floyd's killing at the hands of police in the terms of stolen breaths. They argue that the epidemic of police violence because of implicit bias has become a public health threat for people of color. And of course, the impact of the COVID-19 crisis disproportionately affecting people of color underscores the fact that in healthcare, this has also become a problem in terms of poor health outcomes. Joining me now are Dr. Patrice Harris, who is the immediate past president of the American Medical Association, and Dr. Oliver Brooks, who heads the National Medical Association, which is the nation's largest organization of Black doctors. I want to start with you, with Dr. Harris. You and your recently completed tenure had really focused on the issue of health equity. You helped the AMA launch a Center for Health Equity to focus on these issues. It must feel just incredible to see this become something that is now very much on the front burner.
Well, I am so glad that we are having more intense, more focused conversation around health inequities. Of course, pre-COVID-19, these issues existed, but COVID-19 has brought into stark relief issues around health inequities, racism, and of course, these recent episodes of police violence, again, has demonstrated a disproportionate impact on Black and brown people in our community. And all of these are a triple threat to the health of the public.
Just wanted to stop it there for a second and just to discuss everything. Like I said, everything that affects the Black and minorities communities is a plethora of things. It's not only financial, it's health wise, it's food wise, it's housing, it's everything. And it's like, it's just it's a never ending cycle. But what I wanted to fast forward to is because those who are entering in the healthcare careers and into healthcare careers, and they're going to go into schools. This is something training that maybe I'm trying to get to the area where they bring up Dr. Brooks. But when, Dr. Brooks comes up with a solution and he calls it anti-bias training. Let me see. This thing just hates me today. Maybe
to address these issues, and not just the health community, by the way.
Okay, I should have let it buffer.
Let's bring in Dr. Brooks. You testified this week in the House Energy and Commerce Committee about some of the ways to address this. And one of the main issues you talked about is implicit bias training, anti-bias training for clinicians and other healthcare workers. Why is this so important?
It's important because implicit bias is subconscious. So a lot of times people don't even know that they're doing it. So to reverse the effects of implicit bias, which we see both very directly in police brutality, but also in healthcare, is to have the implicit bias training. There was a study done in 2017 by just using mindfulness. Trainees, those that were in the training, focused more on the moment of what was going on. It did not trigger their internal biases. There was another study done in 2017 that showed the same thing. So if we are going to achieve equity as it relates to race and racism, then we clearly need to have implicit bias training.
So there's tremendous research, some on, for example, the fact that non-Black doctors tend to underestimate pain in African Americans because
we already discussed that, so I'm gonna just take that down. So the thing is that it is real, and I posed a question into the that's going across the banner. It's saying, what do you think, Alyssa, about anti-bias training? and how Dr. Brooks says that implicit bias is subconscious. Like you don't know you're doing it, but you do it anyway. Like I guess an example, I'll give a personal example. My husband, who recently was in the hospital, he kept asking this one doctor over and over and over again for pain medicine. I didn't happen to be there that day because I was working, and my husband, because of his disability, we go through this quite often. So usually I go out as long as he's stable. I go after work and sit with him. But I talked to him at 9 o'clock in the morning. He told me he had asked for pain medicine. By 1 o'clock, I called him again. He had gotten the medicine yet. Okay, that's 4 hours later. And then eventually he got it right before the end of the first 12-hour shift. Okay, he abdominal pain, mind you, but then they would not address it right away. And I had to actually end up calling the nurse's station and asking somebody to give my husband a pill. And my husband doesn't take pain medicine that often, other than Tylenol. But he needed something stronger because he had a lot of pain going on and had a severe infection that was causing the pain. So if he's still in pain, when he came in the hospital with pain, and that was the least of what they addressed. So Alyssa, can you share with me, what do you think about the anti-bias training? Do you think it will help? Do you think it's a solution? um what say you? What you think?
I think it would help. I think I hmm
It's
just
hard.
trying to, yeah, that it is. Um, I do think it would help. I can remember a time my mom, um, she was in the hospital, and all she wanted was a pillow. And she said I called the nurse like 5 times. She wouldn't bring me a pillow. Um, and it was just it. I'd call the nurse station to tell the nursing staff to take my mother a pillow. It's just crazy. I shouldn't have had to do that.
Right. It just the same as my husband's alert and oriented, and he can tell his healthcare needs. And I just found it really strange that I had to actually call the nurse's station and ask them when were they going to give my husband his bill. Now, as a case manager, one thing that I like to advise my clients and my patients that I take care of is, I know anti-bias training. I do believe that there is something as implicit bias that exists. I believe that people subconsciously don't realize they're doing. I get that even when I've had colleagues ask me about my hair because they don't understand why my hair does what it does, but you know, we grow up with stereotypes, we grow up with biases and stuff, but the problem is you can't let those things cross the lines when you are taking care of people. I know as a black nurse, I know my license would be in jeopardy if I treated someone differently than I would treat my own. So I don't do that. I make it a practice not to. And trust me, I've been called everything under the sun. I've had things, urinals thrown at me. I've had all kinds of things. It's hard to work in this field and not get abused some kind of way because you have panicky patients that might just punch your lights out if they need to. But the one thing I think that needs to also be on our side as Black people. We need to educate each other about advocacy. See, there are things that I advise my patients, white or Black or whomever, because I have Asian clients as well as Russian clients. I have all of them. Whoever needs health care in the community and they're poor, I'm there. So it's a whole plethora of things. I'm talking to my Black people because I'm Black, and I'm trying to reach other minorities as well because they can use this information as well. But it's always good. One thing I know that blacks lack when they go into the emergency room are advocates for themselves. They may not have a family member with them that may understand the medical jargon. Because a lot of doctors will come in and they yip and yap really quickly. And you're, because even my husband, this last time in the hospital, he called me on the phone because he said nobody has explained. He said he keeps getting bits and pieces of everything they're talking about. And my husband's case is very complicated. So he don't need bits and pieces. He needs you to lay it out to him so he can make an informed decision. Now, I had to come to the hospital to put the pieces together for him so I could give my husband the informed decision. And I do believe that that will help many of our blacks not experience the disparities, the disparaging things that they may encounter because they can call on their family member or an advocate for them. So it's good, it's wise to take somebody to the hospital with you. Don't go to the hospital alone. Or if you have to go alone, then you can always call the patient advocate because every hospital is supposed to have one. What would you like to add, Alyssa, please?
And a lot of times I don't think that people realize that they can get an advocate. They should actually let them know, like, hey, you can have an advocate here present with you, because we see you are alone. And that way, if there's something that you're not understanding, they can kind of lay it down for you so that you can.
Right. And the advocate is there. They're usually a social worker. Sometimes they're a nurse that is part of, well, the hospitals had to put those things in place because they're one of the things that the Affordable Care Act and the CAP surveys and stuff, it's about patient satisfaction. So they had to put the advocates in place. So if there is a problem with the delivery of care or something, then a patient can always contact the advocate to help speak on their behalf. But I know the number one, I just don't like, sometimes my husband's has had to travel to doctor's appointments without me and things like that. And when you're ill and you're chronically ill, it's hard to concentrate on many things, especially when you got pain, you're not feeling well every day, because my husband has a good day of maybe once every 4 days. So there's things that I'm constantly on guard for him, for his sake, to make sure that the healthcare providers that are providing care for him are paying attention to him, and they're not just letting not addressing the things that he's trying to tell them. I can't explain his pain better than he can. So, but I will make them aware that, look, I'm gonna call you and tell you need to call my husband because he needs to know about when you're gonna order his pain medicine. Those are the things I do for my husband, and I do encourage many minorities to always, if you have to go to the hospital alone, make sure if you're having difficulty with people taking care of you properly or you have some dissatisfaction, you can always call the patient advocate. And another thing I like to advise, Every time you get a hospital stay, there's a survey that's sent to your home and through the mail. Most hospitals do it by mail, or if you're on systems like a My Chart, they will send it to your My Chart. Well, I encourage all patients and any person that had a hospital, fill out those surveys. See, those surveys are what the government actually looks at to make changes in legislatures. So if you more and more people need to fill out those surveys. I even tell my clients that. And when they don't fill them out, a lot of times I call them, I say, did you get the survey? Yeah, I threw it away. Well, don't do that. Fill it out, send it back, because those responses go to the government. And if the government got a bunch of people yelling like, look, you treating us like dirt, okay, there needs to be more things in place for us. And, because, we have to do things legislative. We have to do things in our communities. That's why I started the gardening channel. I'm not the greatest at the gardening, but I'm learning and I'm teaching and I'm showing people that in the city, you can still grow food and be healthy, because you also I know in future streams I'll be talking about the food industry as well. But um Alyssa, do you have it? Because we've been on about an hour and 15 minutes, and it's been a great discussion. But I just wanted to see if you had any other things to add before we end.
I don't have anything else to add. I just would like to see this issue resolved, for everybody to be treated, properly, and how our other counterparts are treated.
Yes,
Um, yep,
absolutely.
yep.
Absolutely. And I do appreciate you coming on and sharing your opinion. I see you having the technical difficulties. I'm always having. Eventually, I'm gonna get this down completely. But I do thank you guys for your support and watching this live stream. Hopefully, I'll have some topics that more and more people will chime in. And I am doing my networking. I'm trying to get some doctors on here who have practices in our community that are helping out the community, because that is my main purpose. I live around my people and I stay around my people, and I try to be an advocate for my people. And not to negate that I have colleagues and stuff that are also advocates for my people, because they take care of the poor and destitute. So that includes their people as well, because there are Caucasians that are not wealthy. So it's more, I know the Black community has so much history built up in disparities. That's why I'm talking to you guys, but it's not just exclusive to you guys. So I do understand that I don't want anyone to think that this is just because healthcare it should be a right, not a privilege. Okay, it's a right as an American. It's a right. I mean, if you're an American, whether you are immigrant or not, you got your visa, you're here, you got your papers in order. It doesn't matter. Right is right and wrong is wrong. And if I say I'm a nurse, I cannot lay there and look at you, whatever color you are, or whatever nationality you are, and say, I am a healthcare advocate, and then treat you like dirt because I have some stupid bias in my foolish head that will make me deliver care to you improperly, and possibly put you in the danger of death. And shame on me if I did that. Shame on everybody. Check yourself. It's not that you're not going to have biases. We grew up with biases. I always So I always was told white people can't dance, and I done seen some white people that can dance better than blacks. So yeah, you grow up with these things, but you have to push them out of your mind when it comes to healthcare, because everybody gets sick. Everybody has to be taken care of. So that's all I have to say. You want to end with something, Lalissa?
Yes, and we have this is the United States, excuse me, and we have health care available here for all, and it should not cost us our life just because of the color of our skin. And
And
we have health care. We should be able to go and get the same type of health care anyone else gets. We deserve it as well.
all right, yes, ma'am. I do appreciate the time. Thank you, Alyssa, for coming on. So that wonderful discussion. I
Thank
just
you for
love.
having me.
Oh, you're welcome. I'm glad that you accepted the invite. And I'll be having more discussions that affect our community, affect the minority community. We'll be talking about career opportunities as well. And I have a discussion coming up with another nurse friend of mine. We will talk about why blacks and everything are underinsured. We want to talk about getting you guys some insurance and making sure that I don't see any more GoFundMe pages for the funerals. It's stop, people. I don't care if you're 20, 18, you have to get some insurance because if black men say they feel like a target, be nice to have some insurance then. We pay for bling bling, we need to pay for insurance. I'm not trying to be anybody's mother. I'm just saying we need insurance because you don't know, only the most high know when you're going. We all got a death date. Flesh gonna die. So, it's better to be prepared. I thank my father. I thank my father for being a very responsible black man and a hard worker. And he taught us to have insurance. My father taught us to have insurance. We didn't have to have a GoFundMe page, but there were family members that I had to take care of that I barely had the money to bury them. And I had to put money together to make sure they were buried. That's because they didn't have enough insurance. So we got to talk about that too. So, as always, I love you guys. Stay safe. Take care of your mind, body, and spirit. I love you, and I'll talk to you later. Until next time, shalom.